According to the National Institute of Neurological Disorders and Stroke, about 40 million people in the United States suffer from chronic, long-term sleep disorders each year, and an additional 20 million experience occasional sleep problems. We spoke with Dr. Paul Selecki at Hoag Memorial Hospital Presbyterian in Newport Beach, who explained sleep disorder and who's affected by it.
Well, sleep disorder basically would be someone not feeling refreshed when they awaken in the morning. So they either have not got enough sleep, a quantity issue, or a quality issue, or sometimes both. So that when you consider that broader definition, recent National Sleep Foundation survey showed that 75% of Americans feel sleepy during the day. The average American gets about 6 hours of sleep. They need 8. The average teenager needs 9, and they don't. We live now in a 24/7 society that's going all the time, and people think that sleep is something that don't have to worry about until they start feeling the ill effects.
And what is the most common sleep disorder?
There are over 80 different sleep disorders that are individually diagnosed. The most common, frankly, is insomnia. The patient who can't fall asleep easily, or gets up in the middle of the night for a trip to the bathroom and can't get back to sleep, their mind gets busy. As the patient says, "Doc, tell me what button to push in my head to stop my mind and I'll be able to fall asleep fine." So that leads to the use of sleeping pills, either over the counter or prescription pills. So my understanding is of all the prescriptions written for health problems in the United States, the most frequent written is a sleeping pill. But there is no sleeping pill that would create normal sleep. It's estimated about a third of the United States have chronic insomnia. It keeps recurring again and again. For some reason, more common in women than it is in men. Very often, especially even in teenagers, their biological clock is changing. And whereas they were in bed at 9 o'clock in elementary school and maybe junior high, they don't fall asleep till 11 or 12 because their biological clock is moving. Yet at the same time, our school system has them come to school earlier. So they have to be at school at 6:30 in the morning to start in their water polo practice or something of that nature, and their classes then begin early. So the average teenager is chronically sleep deprived.
We asked Dr. Selecki what causes sleep disorders.
Very often is some inciting event, an illness, something causes stress in life. An individual goes to bed and they have trouble sleeping because their mind is busy. And that happens for several nights in a row, and they're exhausted the next day, they can't think well, they're irritable, they're forgetful, all because of lack of sleep. And so generally they'll take something over the counter. Products that come out basically have an antihistamine in them which causes sleepiness, and so it helps them fall asleep. The problem is when they start using it night after night after night, it loses its effectiveness within 2 weeks. So that whether it's a prescription item or over-the-counter item, it's got to be done in conjunction with changing their sleep habits and making them, just as much as we know the kind of diet we should be eating, we know we should be doing regular exercise, we also should get 8 hours of sleep every night.
What is your best advice for someone who has insomnia?
The key is to enable sleep to occur. You can't make yourself sleep. So they learn about stress relaxation, meditation. We try to make sure to the patient, if they get up in the middle of the night, awaken I should say, and toss and turn, they're better getting out of bed, to use the bed only for sleep, and not to sit there and fight and, gee, I should take that pill. Very often it works well and the patient knows that I have that sleeping pill in my medicine cabinet, I can take it if I need it, but I'm going to try to work it out on my own.